middle-income countries. At a Healthcare Quality and Safety Summit in Accra, the technical officer for the World Health Organization, Afihqsa-ISQua, gave the startling figures at a Healthcare Quality and Safety Summit.
This year's edition of the Healthcare Summit is the second to be organized by African Institute of Healthcare Quality, Safety and Accreditation, a Pan-African institute focused on equipping frontline healthcare workers and health institutions to improve their health outcomes. It was born out of the identified needs and calls to improve the quality of healthcare and make the healthcare easily accessible. The Deputy Minister of Health, Alex Kojokum-Aban, challenged healthcare practitioners to work towards an effective sector.
The historical thinking has always been that once you have trained the medical professional, the nurse, you have the infrastructure, then the outcomes would be very positive. But recent times have shown that acquisition and application of knowledge by itself would not guarantee the optimal outcomes that we expect. We need to do something about quality.
Technical Officer for Quality System and Resilience of the World Health Organization, Nana Mensah Abrampa, indicated that 3.6 million people do not access the health system, while 5 million of those who require care also receive poor quality care.
People think that when you have access and coverage, that's it, but what good is that access if the quality of care being provided does more harm than good? So you'll notice that 8.6 million deaths per year in 137 lower middle income countries are due to inadequate access to health quality care. Out of this 8.6 million, 3.6 million are people who did not access the health system. However, 5 million are people who sought care, but the quality of care provided was poor.
Head of Quality Management Unit at the Ministry of Health, Ernest Kunedu Asiedu, outlined some measures to facilitate the institutionalization and sustained practice of healthcare quality principles, approaches, and procedures in health facilities.
The ministry, for example, has written a letter to all the heads of agencies that we must create a feedback mechanism, because it's important that people who are unhappy about our services have the opportunity to give that kind of feedback. Service delivery, regulators, other service providers, postgraduate training colleges, they all come together every quarter, and this is being chaired by the Minister for Health. And so whatever decisions or discussions that have are held at the level of the technical committee is what is brought to the Interagency Leadership Committee.
The theme for the summit was transforming and navigating healthcare quality and safety